So in this video, I'm going to show you the contents of your columns within the nursing assistant work list. So let's start on the first column. So the first column is the patient column, and this way you'll be able to see your patient name, the patient's age, their date of birth, MRN and NHS number, and you can enter the patient record by clicking on the patient's name. But if you click on the white space within this column, it will open a separate window. And in this, you can see the patient's allergies and their length of stay. And if you click on the clinical data tab at the top, you can see an overview of the patient's vital signs and an overview of the patient's fluid balance. However, you still have to document the patient's fluid balance by entering the patient record and obviously their vital signs by taking them on your Welsh Allen devices. Moving on to the next column, the location column, this will show your patient's location in your area and their bay and bed number. In the documentation column, here's where you'll be able to see and view your latest nursing handover note from your nurse by clicking on the blue link. But also you can access the patient's record here to make a nurse and assistant note, and I will show you how to do that in a different video. In the EWS column, the early warning score column, you'll be able to see the news data for your patient. And in the task column, you'll be able to see the tasks that are due. So, for example, for this patient has a skin check task due soon and a nurse rounding task due soon. And as you can see by the next patient down, if this task is overdue, it will turn red. To be able to document on this, you can click on Document for the task, which will take you to the form or the area of the patient record where you can document this data. And then we've got the skin and pressure ulcer column. Now what this does is it will tell you what care pathway this patient's on for their skin care. So for this, our patient's on a green pathway. It will tell you how often you have to do your skin check. So in this case, it's every 12 hours, and it will tell you the time of the last skin check. If you want to document on this, if you've got a skin check that's due, or you want to document a ad hoc skin check, for example, if you've taken a patient to the toilet or if you've washed a patient outside the task, you can click on Open Form to document it here. And this will open the form to be able to document your skin and positioning check. In the next column, this is ad hoc forms, and clicking in the white area within the column, you can see all the forms that are available that you may need to document against for your patient. So, for example, if you want to document a height, a weight, a repositioning, a patient property form, a discharge safety checklist, a skin pressure check, or a chaperone form, you'll be able to do this here by clicking on one of these options. But please be aware, as we bring through more care pathways, you will see more forms being available in this column. If your patient's got any high risks that you need to be aware of, it will show in this column. And if I select this patient, you can see that this patient is high risk for their skin, and an overall risk of malnutrition is high for this patient. So you can get a really nice overview over what your patient is at risk of. The next column shows you the latest results from the patient's stool chart. So you can see information here around the last time the patient opened their bowels, but you can also open the chart here to take you to the area of the record if you want to document that the patient's opened their bowels. And in this, you've got your BM column, and this will show you the latest BM for your patient. So for this patient, they've had it done quite a while ago because it's just a test patient. But if clicking onto this column, you can open chart and it will take you to your assessments of fluid balance, so you can find your BM to be able to take it. And the same for the behaviour diary. This will show you the latest documentation for your patient. And again, clicking into the column, opening the chart will allow you to document further information about your patient within that. It will take you again to assessment of fluid balance. The next column is the patient ADLs, where you can see information that's been documented for this patient. For this patient who currently is independent. But again, you can click on Open Chart to take you to assessments and fluid balance to be able to document further for this.